Welcome to NHA Today, the podcast of the National Health Association, one of the oldest and most respected health science organizations in the world. I'm your host, Dr. Stephan Esser, physician, lifestyle medicine advocate, and a fourth-generation plant-based eater with the NHA quite literally in my blood. Each week, we bring you real science, honest conversations, and practical tools to help you become the CEO of your own health. Let's get into it. Hi, it's Dr. Esser with the NHA Today podcast. And today I'm absolutely thrilled to be joined by a mentor, a friend, and an incredible advocate for the NHA for decades. Dr. Joel Fuhrman, MD, is a board-certified family physician, New York Times bestselling author, nutritional researcher who has specialized in preventing and reversing disease through nutritional methods for more than 30 years, helped hundreds of thousands of people around the world seeking to recover from obesity, food addiction, diabetes, heart disease, autoimmune disease. The list goes on. Dr. Fuhrman, thank you for joining the podcast today.
Thank you. Great to be here. Yeah.
So
I'm glad to see you're having I'm glad to see you're having fun with this. It's so great to see you and you enjoying this.
Absolutely. I mean, as you always say, right? I mean, eating well and feeling well is a joyful thing. So, I have some fun questions to start us out with. You're about to go on a 4-week road trip around the U.S. What are the 6 foods that you're wanting to find and eat daily, and why?
To find and eat daily,
Yeah,
or to
the
take
6
with
sort
me.
of classes of foods that you might think are crucial.
I love citrus fruit. I gotta have like some kind of citrus fruit to peel some oranges or something, or something like
I
that.
like it. Okay, that's one. What else?
I mean, I could do without some of those others, but I need to anyway. Well, I have to have salad every day,
Salad,
so
there's
I have to
2.
have some, sprouts and lettuce or something to make, so
Okay,
and
with that being said, what's your favorite sprout? Like that you just like the mouthfeel, the taste of? Favorite sprout?
I don't know. I just I get the mixed sprouting mix, with the
Okay,
high glucopyrafin broccoli sprouts mixed in or whatever.
just
Um,
all of them there. I
yeah.
like it. Okay, so we got some citrus, we got some sprouts, 4 more things that you're wanting on this trip of yours.
I can make the orange to mix with some nuts to make a salad dressing out of it. So the orange
Okay,
will
so we
cover
got
me.
some nuts or seeds. That's a third
So then I
category.
get the nuts and seeds. I have to have
Okay,
I guess my first choice would be walnuts, to bring walnuts with me.
okay, so
But
we got
that's
citrus.
for like health. But for taste, I'd like pistachio nuts in the shell.
Very nice.
Because the pistachio, I like the taste of those the best.
Driving down
So
the
walnuts,
highway, throwing some shells out the window, going through. I
right,
like it. So,
right.
so we got
And then
citrus, nuts,
my favorite cooked
sprouts,
vegetable are artichokes, artichoke hearts.
artichokes. Okay,
So
artichokes.
I gotta have steamed artichokes. Those are my favorite green
That
vegetable.
sounds nice. Nice. Okay. Do you like it where you're like pulling the leaves off and like taking it with your teeth, or do you just like the hearts?
I eat both, but of course I like the heart the best. I cut the
Okay.
choke out and
Yeah.
cut it in half. I cut the choke out, then I steam it for about 18 minutes. Then I'll eat the outer, pull a little bit off the outer leaves, but the heart and the top of the stem are the best part.
Absolutely. All right. So we've got citrus, walnuts, sprouts, artichokes. 2 more things. 2 more things. What else?
Pistachio nuts.
Okay. We got those as part of your nuts category. So I'm still giving you 4. You 2 more.
Let's see. I guess one of my favorite things, green peas, right?
Green peas. Like
Especially English peas in the pod raw.
okay.
I really
Those are
love
nice.
those.
Those are nice. Green peas. Okay. Last one.
Last one has to be persimmons.
Oh, persimmons. Very nice.
Persimmons or mango. Persimmons are a good mango,
There you go. All right. So anybody who sees Dr. Fuhrman on his trip around the U.S., these are the things to get him. Make sure he's full of these yummies. So, it's interesting. I've heard you for so many years talking about food like it's a powerful thing. So give me kind of your elevator speech on why food is so powerful real quick for me, right? Somebody's like, why is food so powerful, Dr. Fuhrman? Go for it.
Well, because we want to have a happy life. And when we're sick, it's hard to be happy if we're sick and have medical problems. And so food is you could say, the major or most prominent um, predictor and influencer of our health and happiness in life, because it affects our body and our brain. And it also affects, what we eat when we're young, or what we eat when before you conceive a baby, when a woman or a man is getting ready to conceive, their diet affects the health of their child, and their diet before they conceive can affect the whole lifespan of that child being born, the entire lifespan. You could say the 6 months before they give birth, what they ate can have profound effects on the whole life of that child for the rest of their life. Whether they have allergies, whether they have an autoimmune disease, whether they get childhood cancer, whether they have a predisposition towards metabolic syndrome, whether, no matter what, it's so food is so important to not to people who ignore it are just headed for tragedy in their life, and their children too.
Yeah. Powerful stuff. Now, I know that you are not a big advocate for counting calories, but instead you developed over time a very unique perspective on nutrients density. Can you tell us a little bit about that equation that you came up with years ago that I always love hearing about? And I think is so valuable for all of us.
Yes, the H equals N over C means your healthy life expectancy, how healthy you're going to be and your age combined later in later life, is proportional to the both the nutritional nutrient content and the nutrient diversity of your diet per calorie. So we're striving. So
So
N over
that
C means
is this what we're looking for?
yes.
H
H
equals
equals
N
N
over
over C.
C. So your health equals nutrients over calories.
Right. So the more empty calories you eat, the more things you shove in your mouth that have no nutrients, the more you shorten your lifespan. Because the principles of longevity, and which are the same as the slowing aging, which are same as the improving the immune function to reverse disease, you have to have a high nutrient density in the cells of your body. Now, how do you get a high nutrient density in the cells of your body unless you've eaten the stuff? It doesn't come in by magic. So you have to, so it's the nutrient concentration and diversity in the cell, which can be measured. We can measure that. And then you have the toxicity in the cell, right? We want low toxicity, high nutrient. But we know that the nutrient level in the cell is what enables the body to reduce toxicity. And so it's an inverse relationship. As the nutrient levels go down, the toxicity goes up. And when we're exposed to endogenous toxins that are from the external pollution in the external world, without a high nutrient density and nutrient diversity, there's no way you're getting those toxins out of the body. And they become much more damaging. So a lot of the things we're exposed to, we can't not breathe air, but we can fill our cells with nutrients to deal with any pollution we encounter in that air. So that's that's the
Love it.
two principles. The next one is body fat percent, which people are socially and, they've normalized to be afraid to talk about people's weight and body fat percent. But as your body fat percent gets high, it produces more pro-inflammatory substances and weakens immune system and increases obviously the toxicity and the inflammation in the tissues. So you could say, let's say, um, estrogen in the breast or estrogen exposure alone is not going to cause breast cancer or heightened estrogen exposure. But you mix the heightened estrogen with toxicity and inflammation, and then boom, you've got the, witch's cauldron of ingredients to create a cancer bomb. So body fat is part of that pro-inflammatory. It produces more estrogen, of course. Body fat produces more estrogen and localized estrogen in breast and prostate tissue that raises risk of cancer. But it's really the inflammation coming off the fat supply that turns on the flame, you know?
Fascinating. And there are two words that I love that you said in there about the nutritional piece that I think you really put your concept of nutritarian living into perspective. That was diversity and nutrient density. And I love that, right? Because so many people sit down at their plate, they're like, I have a salad and it's a bunch of iceberg lettuce with, a little wilted, whatever. And that's not what you're talking about.
You just can't eat kale all the time and expect to have good health. You need a variety of these nutrients, and you increase their synergy when you have a variety of foods. That's why these diets and also diets that like exclude nuts and seeds or exclude fruit or exclude this or exclude that. The more diversity you have, the better, obviously. It's while
Awesome.
still getting your nutrient needs met. And so calories do matter, but because of body fat matters. But here's the thing: when you achieve nutritional optimization, which includes having the right diversity of fibers and lignins and when you achieve that, your instinctual drive to want to overeat disappears. So nutrient density and dietary quality is a major factor enabling people to be comfortable with the right amount of calories. When they're not nourished properly, they get an overwhelming drive to overeat. So, the hottest thing in now right now is the GPL, GPL-1 inhibitors, not inhibitors, agonists, where
Mhm.
they're taking
Right.
exogenous hormone. You
Right.
know, your body produces those hormones. And it doesn't just produce those hormones to stop appetite. It produces a host of other factors and biochemical events that make you not want to overeat. When you eat the right foods, is particularly the right foods, the three most important foods that releases the triggers that prevents you from overeating are green vegetables, pulses or legumes, legumes and beans and lentils, and nuts and seeds. So when you don't, so those foods we actually have appetite and apostat lowering effects. So we're talking about a tremendous amount of everything in America is relying on a drug or a synthetic ingredient, where the answer is really in the proper food supply.
I love it. It's interesting your take on all of this, and I want to rewind a little bit. What attracted you to medicine? What brought you to this table to begin with?
I wasn't attracted to medicine. I had no attraction for medicine at all. I went to medical school because I went to all the natural hygiene conventions when I was a teenager and in my young ages, and I got enthusiastic about using nutrition as a therapeutic modality to get people well or reverse disease. So I went to
Beautiful.
medical school, applied to medical school with a specific intent to be an anti-medicine doctor. It's funny because my wife, I met her at a party. We just started to date. Even before we started to date, she said she's applying to medical school. And I said, "What are you applying to medical school for? Doctors just give out poisons while people continue to eat themselves to death. Doctors have like no positive role." So she said, "Well, if you are so passionate about that, why don't you go to medical school and change things?" Now, I was thinking about that beforehand, but I thought it was like too difficult, or I already graduated from college as a business major. I couldn't go back. I had no pre-medical requirements. But obviously, at that point, I decided to just drop my family's shoe business and go back to Columbia full time for the postgraduate pre-med courses, and then take the MCAT and go to medical school for what I wanted to do, which was be an anti-doctor doctor.
I love it. And now, hundreds of thousands of lives impacted later, you have done that good work. But now, prior to medicine, you were in sports, right? So you were competing at a high level in sports. Tell us about that.
Yes, I was second in the United States in pairs skating with my sister in 1973, and then in 1974 I got hurt and I couldn't walk. So I tried to get back into competition again, but I had lost so much shape, and I did a long fast, which was really, I can't believe my parents allowed Dr. Vetrano to fast me that long. But I fasted so long that I couldn't get my muscular conditioning back in time to train for the '76 Olympics. So I at the '76 national championships, I hadn't achieved my strength back yet. So I came in fourth in the United States and missed the Olympic team by one place. And I
Uh,
got more strength back after that. After the Olympics, I got back a little more, and I came in third in the world professional championships then. So I could have got, for just a few more months, maybe I could have made it to the Olympics, to get back in condition again. But I hadn't had enough time to, you know.
Sounds like it was our advantage that you didn't. So you ended up in medicine and doing all this other stuff because who knows? Made it to the Olympics, who knows what would have happened.
That's
So,
exactly true. I always say that. We
right.
talk about that too. But if I didn't get hurt, if I didn't do this, or didn't do that, well, yeah, but I became a doctor and I've helped a lot of people. So that's always good.
Well, and I was going to say, so you put your passion not only into clinical visits with patients, retreats that are awesome that you're doing, online work, which we're going to talk about, but you've also written a plethora of best-selling books. So for the viewers out there, for everybody who's watching today, what is your favorite book that you've written and why?
I've written 12 books and about 12 booklets. Out of the 12 books, 7 of them have become New York Times bestsellers,
Yeah.
right?
Congratulations.
Now, my most favorite book is not a New York Times bestseller. It's one of my books that did not become a bestseller. It's called Fast Food Genocide. Fast Food Genocide, because it goes into the history of the food movement and puts some historical context and the effect that food has on whole segments of our population, particularly how it's destroyed the um, wealth and health of Black Americans because of food politics,
Right,
So
right.
I found doing the research I found very interesting in writing it. When I wrote Eat to Live, which was published in 2004, which was my sold the most millions of books, was my best selling book. In my research for Eat to Live and collecting all the file cabinets of research articles, then I decided to write Disease Proof Your Child because so much evidence came up that there was a stronger influence on long-term health on what you ate when you were young compared to what you eat when you were older. So because there was so much powerful effect of a negative effect of unhealthy food while cells were replicating and growing, that I wrote the book Disease Proof Your Child, which was also a labor of love that's not a best-selling book, did not become a New York Times bestseller.
Interesting. So if you had to choose one book that you want everybody who's viewing this right now to buy and read, which one of your books do you think every single viewer should read?
Well, they should read the one that's most updated with the most updated modern research, and that's Eat for Life.
Eat
More
for
than
Life.
2,000 scientific references. They can use
Nice.
it as a text. It's easy to read. Each chapter has a summary, like a 2-page summary of what was in the chapter. And there's and for any kind of either layperson or even a health professional, they have all the references laid out on any particular subject they need. So I'd say read that book, Eat for Life.
I love it. Now, not only have you used printed media to transform lives for good, the internet and online access certainly in the last 20, 30 years has really changed the game for you as well. Is that correct? Kind of with your ability to transform lives and influence people?
For sure, for sure. And it enabled me also in my membership at drfuhrman.com. I answer when people pay to join the membership, they can have access to me to ask me their own health questions. It's an online forum, so it's not one to one. They're not using their real names, and I'm opening it so everybody can see the answers, so everybody can learn from the answers I give somebody else, and they
Perfect.
can still ask me their questions. But it's an educational forum for everybody to read and
Love
benefit
it.
from the answers. So I've answered over, I think, 15,000 questions there that are searchable to people's health
Beautiful.
questions.
Well,
Yeah.
and we as humans, right, so many of the things we experience are very similar, aren't they? And the
Yeah.
challenges we can learn from each other. You're speaking at the NHA Health Conference in Ohio this June. Can you give us a sneak peek on your topic?
Um, I guess,
Or is it top
um,
secret? It's too top secret. You just give us a little.
it's too top secret that I don't even know myself.
I love it.
It must be something about, having maximizing our health span,
Ah.
as we age. It's gotta be something like that.
I like it. I like it. So, in other words, you've got to sign up for the virtual or come in person to hear this topic. It's so cutting edge and so secret, which I love. Exercise, I know you're also an advocate for. And when you talk about your own personal health, I know we were sharing a couple minutes ago about your beautiful retreat where you're planting new trees and beautiful growth of things. But you're also you play tennis, you go skiing, you do all these things. Here's my question to you, right? Basic one. Why do you exercise on a regular basis? What are your top 3 reasons?
Mostly because I enjoy it. It really, it's my recreational activities. And I also do it because I like maintaining my youthful, capabilities. My youthful to walk up a mountain or to ski down a mountain or to surf on a surfboard. I mean, it's good, or to go for a jog. So I want to maintain and lengthen my health span.
So maintain that function and performance. Yeah,
I maintain function and performance. Yeah.
I love it. I love it. What about the person who doesn't like to exercise? What's the first thing you say to them with regards to exercise? How do you help to try to move them in direction of, incorporating that? What are some of the things you share with them that you could share with our viewers who are on the fence about adding exercise in?
Well, they don't have to do as much exercise as I'm doing because even 5 or 10 minutes of exercise a day has a huge benefit. It's funny, even a tenth of a teaspoon of ground flax seeds has remarkable benefits for people. Even if they don't have flax seeds, just having a tenth of a teaspoon is a benefit. Just exercising 5 minutes to 10 minutes a day has a benefit. You know, I attract people who are willing to make changes and improve their lifestyle because they want to see large benefits. If they're not willing to maybe eat healthfully, change their diet or exercise, maybe I'm not the right doctor for them. They should go to somebody else. I don't have
Right.
to I don't have to help everybody. Some
Right.
people you just can't help, right?
Yep.
Um,
Now,
so
talking about helping people, right? You and your daughter are doing some exciting new ventures. And if our viewers don't know, your daughter is going to be speaking at the NHA conference again this year. And she is a full fledged doctor herself now. Tell us about the work you guys are doing in your clinic there in California.
right, our clinic is called Longevity RX, but I closed down the retreat. I'm no longer doing the retreat. So so we're not open for that anymore, but we do have this office in downtown in Rancho Santa Fe right here in North San Diego County where we do obviously consultations, but also we have some really high tech regenerative equipment. Because one thing we talk about is that women are indoctrinated with this religious zeal to get mammograms. So they do breast screening. Healthy women are radiating their breasts. Now, why would a healthy person with nothing wrong with them radiate their breasts where radiation can cause cancer? And and of course, the nonsense, of course, that the radiology business wants to tell people, oh, it's not the radiation isn't going to hurt you. It's the same as if you went on an airplane. It's nothing. You know what I mean? Which is totally not true. It's concentrated on the breast.
Right.
It's repeated over and over again. Dense tissue absorbs it more. So we have a machine that does a breast screening called a QT imaging machine with 248 cameras, a very high tech machine that's better, much higher resolution and better than MRIs, ultrasounds, and mammograms. So we have the equipment to screen a woman's breast tissue without exposing her to radiation if they want that. And we have an echo light machine which measure bone density without radiation. We have a lymph equipment that can build back bone, help assist in build back bone, of course, with exercise too. But lymph helps turns on the osteoblasts and can help heal osteoarthritis, but also can really make the bone more dense. But it's not like you come in and get one treatment. People have to get like 12 to 20 treatments on the machine, and they still
Right.
got to exercise. But we can repeat the echolight REMs that we can repeat to see the bone density is improving. So we can document improvement in bone density. And the echolight REMs give you a more accurate fragility score than a regular DEXA scan. And then we
Awesome.
have the amortal chamber, which a person just gets into this chamber with red light, pulsed electromagnetic therapy, inhaled hydrogen, acoustical vibration, and meditation,
Wow.
all happening in the chamber simultaneously as an anti-aging thing. We have one of those at the office too. And I also have a soft wave TRT machine, which is able to give those soft shocks to break up calcifications. Like if a person has a bad wrist or a frozen shoulder, a carpal tunnel, or knee arthritis, we can use it's a type of shock wave that's more gentle but covers a wider and deeper area with electromagnetic fluid shock with a bladder. So it's really helpful for injuries and help. And the combination of having these multiple types of regenerative equipment, like the soft wave with the lymph machine, it's not to do with lymph nodes or lymph system. It's LIMFA. It stands for the type of um, electronic signals that help turn on cells to grow and build bone. But in any case, that machine is also used to help faster recovery from injuries, like tendon injuries. So they have them a lot in Europe, like the soccer teams and tennis players
Nice.
use them in Europe to help recover from injury. So we have these, and we had to send a doctor to Italy to get the machine because we couldn't get it back they couldn't get it back over the mail with the tariffs or the restriction of sending stuff in. So we had to send a doctor there to carry pieces of it back in various suitcases. So it's
Huh.
kind of funny, but anyway,
Well,
so
now
yeah,
it
we have
sounds
some
like you've got
equipment.
the high tech combined with the foundational nutrition. You've got the best of both worlds. You got it all in there.
Yes, it really is effective because when a person walks in with something bothering them, like their knees hurt them or they have plantar fasciitis, or because a lot of people, almost like half the people, are walking around in pain.
Right.
So yeah, as you know, you're into this too. So yeah, so we can help their pain as well as get them in better health and help and also, when we're picking up a person with some advanced testing, we can get them, they have more motivation to make the nutritional and lifestyle changes we want them to make. Otherwise, you're just telling a person, eat healthy and exercise, take the right supplements. They never come back. They don't listen to you. But if you can, they don't want to listen. But if you show them that there are things definitively wrong in their blood tests, and that they have maybe some, an early stage cancer marker that we have to fix, then they'll be willing to, okay, what do I have to do to fix this? So it does increase the compliance and motivation by doing some a little bit more extensive testing and treatment.
Fascinating. Well, I enjoyed, and I think our viewers did as well today, about kind of your journey and where you are now and what you're sharing with people through all the different mediums. And, I want to ask you to leave us with a couple words that you can to the folks here who are viewing today, and just kind of leave them with some words of inspiration and encouragement here at the end. Whatever you want to share, Dr. Fuhrman, the floor is yours.
Well, I go to these health conferences, even NHA conferences, and you see a lot of people that know this information who are not applying it rigorously. Oh, they're still, their food addiction and their effects, this social network they're living in is so powerful that it makes it so difficult to make the full commitment to doing this. So they know it, they're enthusiastic about it, but they're not getting the same benefits. They're not getting the benefits they should be getting. And I'm saying here, different from most anybody else, the money is in the last 10%. You know what I mean by that? I mean, you were like a professional athlete too. Like, you can be good at something, but you got to go all the way and train everything properly to really get the full reward out of it. And if you really want to see the full benefit, where you really enjoy eating this way the most, and you really instinctually feel you're getting the full benefit, which means your right body fat percent, your right, you can't just do this part of the time at 80% or 90%. You got to go for it all the way. So I'm just leaving you with the concept that it's easier to do it all the way. It's harder to have your one leg in both worlds. It's like an alcoholic who keeps drinking on the weekends and keeps making you want to drink more. As you keep thinking you can't give up those foods, they just make you want them more the more you eat them. But when they're not in your world and you're learning how to be creatively, make healthy foods taste great with the recipes you love without compromising, this gets easier and you don't want those other things anymore. So I'm saying, jump in with both feet. It's easier, not harder, because those things will stop calling your name, and then you'll see the results that are so magnificent to really see the full benefit you get from that little extra effort. You're already putting in 90% effort. It's the 10%, just a little bit more that makes all the difference in the world.
Love it. All right, everybody out there, you heard the words. Let's apply it. Let's make it happen. And come join Dr. Fuhrman at the NHA this summer for the annual conference to hear what he has to share about HealthSpan, which is top secret. All right, Dr. Fuhrman, thank you again for joining today.
Thank you, Dr. Esser. Great to see you running these things, doing these things. It's great.
Thanks for joining me on NHA Today. If today's conversation inspired you, I want to personally invite you to join us at the NHA Annual Conference, where you'll hear from incredible speakers, including many of the guests you've been meeting right here on this podcast. It's one of the most meaningful weekends of the year for anyone serious about their health. Get all the details and register at healthscience.org. You can also follow me on social media at Esser Health and find NHA Today on YouTube, Spotify, Apple Podcasts, and wherever you listen. Until next time, be well, stay curious, and keep moving forward your most vital health.